Alright, hello guys, welcome back to the channel. Today we're going to be covering where we left off last week on heart-related diseases, okay? Just a brief overview. So we're going to start off with CHF, congestive heart failure. So basically what you guys to know about CHF is that it's basically the pump, the heart is the pump, right? And the pump is failing, okay? So the pathophysiology of CHF is that the left ventricle fails and it has an increase in the pressure, right? And the fluid basically backtracks from the left side into the lungs and then into the right side of the body, causing swelling in the veins, okay? So if you guys remember from one of my earlier videos where I talked about the pathway of the blood going through the heart, right? How it goes from the right atrium to the right ventricle to the lungs to the left atrium to the left ventricle, right? You basically just have to do all those things in reverse. And that's how you understand symptoms of left-sided versus right-sided heart failure, okay? So we're going to dive into the signs and symptoms, right? There's going to be some anxiety and confusion. Why do you think we get anxiety and confusion, okay? Well, first of all, it's usually due to the lack of oxygen getting to the blood, right? When there's no oxygen perfusing the blood, people tend to get this change of mental status, they get anxious, okay? JVD. So it's basically when the jugular vein along your neck gets really engorged with all this blood because, like we said, it's the reverse of the blood flow, right? And then normally it's blood's coming down the jugular vein into the right atrium, right, into the ascending aorta, right, into the superior vena cava, right, into the right atrium. But all of that is getting reversed. So it's going back up the superior vena cava into the jugular vein, right? So this is why you're going to see that bulge on their neck. When you do your assessment, you're going to hear crackles and dyspnea. Shortness of breath, you're going to hear the crackles, which means fluid in the lungs, right? We kind of hinted on that or talked about it in our respiratory lecture. You're also going to see ascites and pitting edema. So this is when the fluid gets into the interstitial space between the cells and the vessels. There may be a cough, pink frothy sputum. Now, this is one of the hallmark symptoms of CHF, okay? So, the color that, like, where the pink frothy sputum comes from is from the blood in the lungs, okay? Now, there's also going to be a weak pulse, low BP, like a soft BP, confusion, anxiety. The people are going to be tired. You know, the pump isn't getting enough blood. It's not pumping out the blood well, and the oxygen isn't being backed up or isn't being delivered properly. Nausea and vomiting comes from the extra fluids being backed up in the stomach and the decrease in peristalsis, right? Okay. So there are going to be specific signs for left versus right-sided failure. And on a very basic level, you can just summarize knowing that left side is the crackles, okay? Um, any of the lung and respiratory related symptoms, I want you to think left-sided. So that's how I remember it. Left for lungs, and then right for rest of the body. That's where the swollen ankles, the edema here, the ascites, JVD, these are all right-sided symptoms, okay? So what do we have to do? Well, the doctor's probably going to prescribe a diuretic to get rid of all the fluids. So most commonly like Lasix, right? Or Bumex as well. You want to relieve the symptoms of anxiety and fatigue. So you want to, it can be kind of scary for the patient not be able to breathe, right? So you want to be like, hey, we're going to get you some of this fluid off to help you breathe a little bit easier. And then there's going to be the primary, secondary, and tertiary preventions, right? So primary, to prevent it, you want to do eat heart healthy, right? You want to have good screenings, right? Secondary, when they already have been diagnosed, right? You want to manage medication. So this is like usually with the Lasix as aforementioned, and stopping any smoking, which causes stress on the heart even more in the lungs. And third, to try to get them back up to where they were, a cardiac rehab. Okay. And the reasons for left-sided heart failure can be due to hypertrophy, which is enlargement following like a post-MI. Like oftentimes, the heart muscle feels the need to get stronger, and like with any muscle that works out, it tends to grow bigger. So that can cause the heart to swell on that side and be really strong, causing this heart failure to happen on the left side. Moving on to edema. So basically it's just pitting, right? Like when you push down onto a really swollen patient, you can literally like sink your finger into their skin. It's like the Pillsbury Doughboy, right? So some causes are like, prolonged immobilization, low protein levels, obesity, and pregnancy. This is because like these all affect like the water and oncotic pressure, causing the fluid to leak out of the veins instead of being inside the vessels. Okay, but that's a little bit more advanced. You guys don't need to know that right now for an intro to nursing level kind of class, which this is for, like which this exam review is for. And we're going to talk about how we grade them. Okay, so they go to 1 to 4. Okay, you would measure it, to like a slight like press with that resolves within 10 seconds is usually mild. 4 millimeters, 10 to 15 seconds. 3 plus if it's 6 millimeters or less, like greater than a minute. And then 4 plus is when like it's very deep hitting. It takes a really long time for the leg to rebound, or wherever you're grading them on, to come back to normal. Okay. I memorized these numbers for my exams. Sometimes it was helpful. Sometimes, and this is a picture. Like if you were to eyeball it, you could probably say like 2 or 3, right? And then non-pitting is when it's brawny. It means that the edema is still there, but it does not respond to any pressure or any cause of an indentation. It sometimes have this like brownish or darkish discoloration. And some causes is usually peripheral vascular disease, PVD, and it's where the blood is pooling because it doesn't have anywhere to go or has difficulty going back up, and it becomes stagnant. Edema can happen anywhere in the body, but most of the time it's usually in the foot and legs because of gravity, right? Like due to the PVD. Okay, capillary refill and the pulse grading. In a similar fashion to edema, it's also on a scale, and what we're basically doing is capillary refill is assessing how well the blood flow is traveling through the extremities of the body. So you usually do it on the fingers or the toes, okay? So what is normal, right? Anything less than 2 to 3 seconds. And if it is greater than 5 seconds, that's usually indicative of poor capillary refill, which makes you want to think like, oh, this person has poor perfusion to the extremities, which may lead to decrease in sensation, poor wound healing in the extremities, things like that. Pulse grading, like we said, is grading on a scale, and then there's 2 scales. There's the 0 to 3 scale, which is 0, you have no pulse, which I've mentioned before. You should never grade it as 0 unless they actually don't have, like a pulse there. You should try Doppler first, right? 1, if the pulse is weak and thready. 2 is a normal pulse, and then 3 is a very strong and bounding pulse. Now, it can also be 0 to 4, and just know that on this scale, 3 is normal, whereas 2 was normal for 0 to 3. This may be a question you want to bring up to your nursing school professors when they're writing an exam. Clarify which scale they used. Mine mainly used 0 to 3, and I had to clarify with new professors that they weren't grading off this scale. Sorry, I guess my cat wanted a cameo. Some helpful tips when it comes to these types of questions is that if it's talking about capillary refill, make sure you read the question carefully, okay? Because if it says it's less than 2 to 3 seconds, that's a good thing. We want it to be less. Long capillary refill is bad because that means it's poor refill. I know that's such an easy and obvious thing to say, but in the exam, when you're nervous, you're like not reading the question carefully, you're like, less than 3 seconds? Oh my god, less than? It's bad. No, like, calm down, take a breath. Remember, less is good for capillary refill. She's going to keep going for a while, sorry. All right, insufficiencies. So we're going to be talking about peripheral vascular disease, which we kind of talked about earlier, and peripheral arterial disease, PVD versus PAD, okay? So we're going to start off with PVD. The pain, it's worse withstanding, better when the legs are elevated. The memory trick I use to memorize this is when you throw your hands up in like a peace sign, I like to pretend these are the legs of the patients, right? And then like say your nails are like where the feet would be. You want to throw them up, right? You want them to be elevated so the blood drains from the legs back to the heart, right? So like a V, PVD. You make a V with your hands, or your fingers, I should say. A pulse, it's going to be 2 to 3 plus because there's no problem with the blood getting to the foot. It just has a hard time coming back, right? So the pulse is still going to be there. Edema is going to be there because it has a hard time leaving, kind of what we talked about earlier. There's pooling in the feet, right? Like the blood pools there in the extremities. So you're going to have the present brawny, edema, etc. Temperature-wise, warm and flush, right? Because the blood, it's warm and it has no problem getting to your foot. It's warm, okay? Now the color, it's going to be normal or slightly brown pigmented because of the brawny edema. Now, wounds are usually irregular shaped, usually on the sides of the ankles, may have some granulation, okay? Now, on the other side, peripheral arterial disease, it's talking about the narrowing of the arteries, reducing blood flow, okay? So the way I remember it is I dangle, or the treatment for this is I dangle like from a V, where I made a V with my fingers, I flip it, right? So it's kind of pointing down, and that's kind of like an A, right? Without the middle part. That's how you want your legs to be. You want to dangle when your patient has peripheral arterial disease, like an A. You want to dangle because the blood has a hard time reaching to the extremities. So pain. There's going to be that intermittent claudication, the cramping, because when you exercise, it's causing your vessels to contract and squeeze, right? And when you rest, it gives you a chance, to dilate and get some more blood flow in there. It gets better with rest, and then if it's not treated, the pain can persist. Now, pulse, it's going to be the opposite. It's not going to be a strong 2 to 3 plus pulse. It's going to be weak, absent, unequal from the other side if it's unilateral, and poor capillary refill. And that makes sense, right? Because we just said the part has trouble pumping the blood to the extremities. The blood's not getting there, right? So that's why they have a weak pulse. Keeping that same train of thought, edema, there's not going to be edema, right? Because there's no blood getting there to the extremities. How can you have something pooling in your feet when it can't even get there in the first place, right? Temperature, we just said blood is warm, right? If you can't get to the foot, your foot's going to be cool, right? When you're cold on your extremities, you're all cool, right? That's exactly what it is. It's not getting there to the foot. The color, it's going to be, blue, gray, pallor, because once again, the blood's not getting there. Now, the wounds, they're usually regular in shape. They have a pale base, and they have well-defined edges. Some notes that I have for you guys are the poor healing in PVD contributes to the irregular borders of the wound because it is swollen, and the inflamed tissue doesn't regenerate in the same way in a structured manner. In contrast, the PAD ulcers form sharply because of the sudden ischemic tissue death. Okay. All right. My tips for that section is to just draw out like a table and compare and contrast the two. Write down as many times as you can from memory. Just repeat it a couple times before the exam and you'll get it. Blood clots. How to assess. So they teach the Hohmann sign. It's the pain in the calf when the foot is dorsiflexed, so toes to the nose. It's not a 100% indicator, so you don't always want to rely on it for an assessment. And also, I think in more recent clinical practice, we don't really go by this. You don't want to do this. And another thing is Virchow's triad. So I like to think of Virchow's as, a girl. May or may not be. I don't think it is. But I just remember she for Virchow's triad. And the reason why I remember she is because there's stasis, because of the stagnant blood, hypercoagulability for H, meaning that the blood sticks together, and E, endothelial damage, such as inner vessel cell injury from smoking. What these three things are basically the risk for getting a clot. So if you have stagnant blood, the blood tends to stick together, and if you're a smoker, you're going to have a high risk for clotting, okay? Now, in the same frame as blood clots, deep vein thrombosis is when there's a blood clot in one of the deep veins of the body. Usually it's the legs, but it can happen anywhere else in the body. There's going to be the pain, the swelling, redness, warmth, the Hohmann sign sometimes, and then also shortness of breath. If it is left unchecked, the embolism which is basically the blood clot breaks off and it goes into the circulatory system. It can go to the lungs, heart, or brain, and it can cause a stroke and all these nasty, life-threatening diseases, like a pulmonary embolism, right? And then the risk factors for getting these clots are a sedentary lifestyle, which matches out with the stasis, hyperlipidemia, and smoking because of like the endothelial vascular damage, right? Okay. Now, the ankle brachial index is basically a non-invasive tool for checking PAD. It's using a Doppler and ultrasound on the arm and the leg, and you want to inflate both cuffs. For healthy people, the pressure should be higher in the ankle than in the arm because it's further away from the body, so it needs more pressure to get there, right, than the arm, which is closer to the heart. If the pressure is equal on both the foot versus the arm, it means that there's reduced flow to the peripheries, right, like the lower extremities, which is indicative of PAD. You don't really need to know all this. This is probably one of like the lower yield questions. If you just have time, or extra material, you can study this and learn it, but it's not that difficult of a concept. Okay. And obviously health promotion for the cardiac. Don't smoke, eat a heart healthy diet, right? And make sure you exercise. All the things which I have a hard time doing down here because work is stressful. But hopefully that helped. This is just the slide that I used for the heart video for the blood flow. But that's it for today. We're going to pick off next week with some practice questions covering the couple past videos. Okay, good luck studying.